So I have a handful of therapists I refer to. I have a couple of psychiatrists I use. And if this person that's coming to me has a different level of need than I can plug them into, I'm not going there, particularly online. Because online, it's not just their support system. I want them to have a strong support system. It's my support system. So I use, as an initial screening point for me, I use what's called the SAD person scale, which it screens for suicide, but it also screens for other factors, and it just keeps me cognizant of some of the risks I need to be aware of. So it asks, SAD person scale is based on which sex, male or female, because males have more of a propensity to commit than females, their age, whether they are depressed or feeling hopeless, whether they are using drugs or alcohol, if they have any cognitive deficits or they're hallucinating, and it goes down. So when I check off in my head, I don't literally give them the SAD person, but as I go through it and check off, there's a little rating scale. It's like 1 to 7 points, and if I'm seeing somebody 3 or 4 points out of those risk factors, I'm taking a look at that and deciding whether that's something I want to take on in my own private practice. Now, if you're supported within an agency, that may be a different response. But for me as a private practitioner, which I think is most of your audience, Rich, with the Psychotherapy Networker, I tend to be more conservative with who I'm willing to take on.